We've known for a long time that hemophilia centers are important to optimal outcomes for patients with hemophilia. In fact, the CDC found that there's a 40% decreased morbidity and mortality in patients who receive their care at the comprehensive hemophilia treatment centers in the United States. And we've known also for many years, those of us in the hemophilia treatment centers, that we can't provide those services without 340B income. But importantly, more recently, the National Hemophilia Program Coordinating Center was able to conduct a survey that demonstrated that the majority of staff support for nurses, social workers, and physical therapists, vocational educational counselors, comes from 340B income in the hemophilia treatment centers in the United States. And so we know that these programs rely completely on this income to provide services, not just to patients who use the 340B drug pricing program, but to all patients that get their care at the hemophilia treatment centers. Next, we're going to hear from two very important people. They're both consumers, they're individuals who have hemophilia and who receive their care at hemophilia treatment centers. They actually came to us to say, we feel like we're educated consumers. We know a lot about hemophilia, we've been involved for a long time, and yet we didn't really fully understand the importance of 340B programs. Once we got it, we felt compelled to try to do something to help other patients and families understand the importance of 340B.
When I was small, I probably had the same experience that a kid in New York would have. If I got a bleed, which was, not all the time, but consistent, the treatment was you go lay in bed somewhere, whether it's a hospital or it's your home, which meant you didn't get to be out with your friends doing stuff. So the thing you noticed most, other than hurting every once in a while, was kind of isolation. Treatment, like I said, was ice, pressure, and whole blood. Or if, for example, you had an oral bleed, lose a tooth or something like that, it was all hit and miss. They would try vitamin K, which doesn't work. They would try some sort of a sealant, which really doesn't work. It would just have to be, eventually you get a transfusion and it would stop it. So having the center, made all the difference in the world.
And so I grew up, I guess, in the first generation really of people that got better care, that went from the older model of getting whole blood or cryoprecipitate and going to the emergency room every time you had a problem to actually having a doctor who specialized in hematology, and which has since then evolved into the entire HTC model.
So in the last 40 years since I've been involved in hemophilia care, the difference in the lives of patients and families with hemophilia and the difference in their health outcomes is really remarkable. In 2016, 2017, we have a completely different story. We have people with severe hemophilia that I follow that are college athletes that are working full-time. We have most of our parents have both parents working. Most of the children don't miss any school or maybe miss a couple days a year just to come to clinic. And they're participating in baseball and soccer and music lessons and Boy Scouts. Their lives no longer revolve around hemophilia.
Keeping the HTCs viable and with the revenue streams they need to support the hemophilia community is very important to me. It's critical. I've experienced the world without HTCs. Nobody else has come close to matching the comprehensive approach to HTCs. And part of the revenue fund stream for HTCs is the 340B money.
One of the best things that you get when you go to your HTC is you get comprehensive care, which is also called integrated care, and really it just means that you have a full team at the ready to take care of you in one single office visit. And more importantly, if we didn't have HTCs anymore, not only would we have this inconvenience of having to make 6 separate appointments, we might not have access to those professionals at all.
It's critical that people understand that they can drive the success of the HTCs. Without people supporting them and not just using them, but supporting them financially through the 340B program, the future is not great. The people working there have developed such an understanding of hemophilia and the challenges it brings to not just the hemophiliac, but the family. That's sometimes the challenge to the family is even bigger than to the hemophiliac themselves. I've got 3 grandsons, and 2 out of the 3 are hemophiliacs.
You can go to your state capitol and talk to your representative, and here you are saying that here's funding that actually has a return, that actually can save the government money and help them balance their budget, and they're immediately going to start to look at you as someone that has an idea where they can help instead of just another handout looking for money from them.
And that's really true with the companies too. It's got to be a two-pronged approach. We're not expecting everybody's going to rush to the Capitol to convince their congressmen or their state representatives that this is the way to go. But everybody has contact with the insurance companies, and I think the REC, the chapters and the HTCs, both should be able to provide the resources and perhaps some data, some information for individuals to use when talking to an insurance company, because insurance companies generally don't make decisions based upon what feels good. They make decisions based on a financial model. They're going to know what saves them money. Without comprehensive care, you're going to have more bleeds, probably more severe bleeds, and you're going to have complicating factors, other things going wrong because of bleeding that can drive up the cost of health care.
It's important that you understand that the HTCs are federally funded, that without that federal funding, they probably wouldn't exist. And you should probably talk to someone at your next visit, whether it's the nurse or the social worker, whoever you feel comfortable talking to, and saying, what is a 340B and why should I care? And you'll probably have some eye-opening answers about what that HTC does, what it means to you, and what the very modest things that you need to do to keep it going.
There is an emotional component to a relationship with an HTC at any point, because there's somebody trying to help you, and to some degree there's going to be an emotional component to that, gratitude or whatever it might be called. But when you have family members that are being helped, especially grandchildren, it adds a new dimension to that.
Without an HTC, that team doesn't exist. And so you don't get comprehensive or integrated care, and you don't get good care.
Whether you get factor from the 340B program or not, you're going to be taken care of at the HTC. Everybody's benefiting from the comprehensive care model, but it has to be paid for. And people, I would hope, would factor that into their decision in deciding where to get their factor.
It's very important to me that HTCs exist to not only continue to take care of me as I get older, but to take care of my children and my grandchildren.
To keep the system as broadly funded as possible, we all need to be active and working to assure the 340B program and the comprehensive care centers are able to provide what we need for now and for our grandchildren.
For patients and families, please talk to your Hemophilia Treatment Center staff to learn more about the 340B drug pricing program. And if possible, contact your local NHF chapter to see how you can join initiatives to help support comprehensive care for hemophilia and other bleeding disorders.